This is Philip Dimitrakis with U.S. Benefit Solutions, and I'll be conducting the presentation today. I am Vice President of U.S. Benefit Solutions, and I'm also a licensed insurance agent and certified in the individual and shop marketplaces. Today's presentation focuses on the Affordable Care Act, also known as ObamaCare, and we are hoping to inform individuals and their families and to provide them with the knowledge they need now to protect themselves in the future. What is the Affordable Care Act, or ACA? The Affordable Care Act is a series of health reform laws that are approximately 2,000 pages long that were signed back on March 23rd of 2010. Now, the primary goal is to help Americans obtain health insurance coverage. The ACA also provides issuers from limiting or excluding coverage related to pre-existing conditions, which is going to have a positive impact on millions of Americans come 2014. So what are the health law changes in the ACA? Well, for one, you have the creation of marketplaces in each state. Some states have federally facilitated marketplaces ran by the government, and other states have state-based marketplaces ran by that individual state. Now, we will be discussing the differences between the two later on in the presentation. You also have the expansion of Medicaid in some states, giving those who are not financially able to afford coverage the opportunity to obtain coverage. And finally, individuals will be required to have minimum essential coverage, which we will discuss further on in the presentation as well. Now let's talk about the consumer protections in the ACA. You have a guarantee issue requirement regardless of health status, so now the insurance companies cannot decline you based on your medical history or pre-existing conditions. The consumer protections also prohibit higher premium charges based on health or gender. The consumer protections prohibit coverage limitations or exclusions based on pre-existing conditions. So you don't have to worry about the issuer or the insurance company putting a rider on the policy that excludes your medical condition. It also prohibits the issuer from precluding an individual based on clinical trials. Now the issuer can't sit back and tell you that they want to see how your current test unfold or results before they will issue a policy to you. Finally, you have the introduction of the 80-20 MLR rule, which will be defined for you in the coming slides. Young adult coverage is also going to change for the better through the Affordable Care Act. Health plans must now cover young adults up to age 26. Through the ACA, young adults can now join or remain on their parents' plan even if they are married, keeping in mind that it doesn't extend to the spouse or children, not living with a parent, not attending school, not financially dependent on a parent, or eligible to enroll in their employer's plan. So as you can see, there are a lot of different options for young adults through the ACA. Now let's talk about what a marketplace is. You've heard me mention the two different marketplaces in the very beginning, so let's go ahead and elaborate a little. A marketplace provides consumers with the ability to compare and purchase health insurance without all the confusion. The states that decided to have a federally facilitated marketplace allow the federal government to run the marketplace. The states that decided to have a state-based marketplace will run their own marketplace without the federal government intervening. Now, marketplaces do consist of individual and shop. And shop stands for Small Business Health Options Program. And to check out the different marketplaces available there in your state, you can go to healthcare.gov to find out what type of marketplace your state is involved in. The individual marketplace allows consumers to shop for coverage within their state. It allows for paper and online eligibility determinations or eligibility assessments for insurance affordability programs. The affordability programs include tax credits and cost-sharing reductions. The great thing about the marketplace is that there will be a single streamlined application that allows consumers to receive determinations for all programs they're eligible for. Applications can be filed in person, online, by mail, or by phone. The marketplace makes for a no wrong door system, so every insurance company offering coverage in the marketplace will be available in one place. So come 2014, you can check with your state and see if you have a federally facilitated marketplace or a state-based marketplace, and everything will be available to you on one site instead of you having to shop every single insurance company one by one. That's what a no wrong door system provides you. There are several functions of a marketplace, so we'll discuss that. The marketplace determines individual enrollment into a qualified health plan, or QHP. It also determines a consumer's eligibility for tax credits towards their premium, as well as their eligibility for cost sharing towards their benefits. The marketplace will also determine whether a consumer is eligible for Medicaid or CHIP, which is the Children's Health Insurance Program, and it also determines which plans it will certify to offer consumers, as well as facilitate the enrollment process into a qualified. The marketplace will have to verify your eligibility into a qualified health plan, tax credits, and cost sharing. Therefore, the marketplace will verify an applicant's qualifying status using the data from key federal agencies such as the Social Security Department, residency status, citizenship, immigration, the Internal Revenue Service, or the IRS, and credit bureaus such as Equifax and TransUnion. One of the functions of a marketplace was verifying eligibility for Medicaid and CHIP. Medicaid and CHIP provides free or low-cost coverage. Medicaid is administered by states to provide health coverage for low-income families and the elderly people with disabilities. CHIP is administered by the states to provide no-cost or low-cost health coverage for children in families who earn too much to qualify for Medicaid but can't afford to purchase private health insurance. CHIP also covers pregnant women, and in most states, consumers will have to have an annual household income at or below 138% the federal poverty level or federal poverty guidelines to qualify. One of the most important changes within Medicaid programs is that more adults will be able to qualify now. Earlier in the presentation, I informed you that one of the health law changes was that consumers would need to purchase minimum essential coverage. So let's go ahead and define it. Minimum essential coverage is the type of coverage an individual needs to have to meet the requirements under the Affordable Care Act to avoid any penalties. Now, the types of coverage that qualify as a minimum essential coverage are any marketplace plan or any individual major medical plan that you have now, any employer plan or COBRA, Medicare, Medicaid, CHIP, which is the Children's Health Insurance Program, and finally TRICARE, the Veterans Programs, and the Peace Corps Volunteer Plans. All of these types of plans meet the minimum essential coverage requirement. Qualified health plans, or QHPs. A qualified health plan is the type of plan an individual needs to purchase in order to avoid tax penalties. Qualified health plans are defined by the minimum requirements they must possess. Now, the plan must have a set of comprehensive benefits called essential health benefits. The plan will have limits on cost sharing and out-of-pocket costs, which protects the consumer from expensive medical bills. And lastly, the plan must have an adequate network for the insured individual. Now, make sure to check your individual marketplace to see which QHPs or qualified health plans are available to you. The ACA requires that plans inside and outside the marketplace offer a comprehensive package of services called essential health benefits. Now, there are 10 essential health benefits: ambulatory patient services, emergency services, hospitalization, maternity or newborn care, laboratory services, mental health, pediatric services, prescription coverage, rehabilitative services, and preventative and wellness. Earlier in the presentation, we discussed some of the consumer protections provided by the ACA, which included the introduction of an MLR rule. Now, the MLR stands for medical loss ratio. This ensures that at least 80% of your premium dollars are spent on providing health care. Now, this limits the issuer or insurance company from spending your hard-earned money on things other than health care, such as administration and profit.